a really warm welcome, and it's so wonderful to see you all here. Today's all about speaking up and having a voice. We've also got hundreds of people joining us online as well.
We've got to try and ensure that policymakers and those who fund the implementation are held to account and deliver on these types of interventions long term, because otherwise we have got real problems.
It was very, very good, and it gave us a perspective of what's going on around the world.
I loved seeing the international perspective and just how relatable it is across the world.
Your fight is our fight, because 1 in 2 nurses are saying, bye-bye, I'm looking for the exit sign, I want to leave. And we know that 1 in 5 healthcare workers are looking to retire early, and we need to change that very quickly.
The pandemic revealed just how dangerous America's healthcare industry practices are. And healthcare workers are done. They are done being applauded as essential while being treated as expendable.
The uphill battle to have our voices heard remains, as does the need for your clinical insights and experiences to be afforded a seat at the decision-making or policy drafting table.
If you go back through the history of changes in healthcare, the hospital scandals, it's almost always been a nurse that stood up to be the whistleblower.
Trust your gut, stick to it, and keep fighting. If you know it's wrong and it doesn't feel right, keep speaking.
It's been fantastic. The speakers have been so motivating about fighting for just improved conditions and how to, keep nursing going.
I think they all brought different aspects that we can all learn from, and hopefully we can change stuff.
My wife's a nurse, my daughter's a nurse, and when we start talking to the person we see in the mirror, and more importantly when we start talking to the person at work or in another trusted place, we realise that we're not alone. We realise that we're actually going through similar things. And by crikey, we can suddenly help each other.
The whole day has been just amazing.
I think Jane Caro was really the best.
Jane Caro?
Jane Caro, she was just amazing, so inspirational about just learning to speak up for yourself and fight for what you need.
I have absolutely loved watching nurses and midwives taking to the streets and demanding their rights, demanding ratios, demanding proper pay, not asking for it, not being nice, not being polite, demanding it.
I feel very empowered from this day.
Really lighting a fire up our asses, I think, and trying to impart that confidence that we should have to back ourselves.
And just not be gaslit by society and, people just trying to talk down, have no idea what they're talking about.
She's just bloody awesome. And Georgie, of course, because she was hilarious.
The one that really annoys me, if they start going on like, oh, I'm allergic to bees. We're not going to give you bees!
Absolutely hilarious. I couldn't stop laughing. Good pelvic floors I found out I have today.
It has been a fantastic experience, feeling the camaraderie and just feeling like you're not alone.
It's great seeing all these nurses and midwives from across from New South Wales and all be together and know that we're all in this fight together for ratios and to make our working conditions better and safer.
I think the biggest takeaway from our conference is essentially just to focus on what our issues are and what to really fight on and how to affect that change.
We need to continue to be the leaders we want to see at work. We need to rise above and lead with a vision for how health should be managed.
We're fighting for politicians to show you the respect you deserve, to listen to your clinical judgment about what is really going on in the system, and then to make the right decision to fix it.
Pressure on government, pressure on political parties, pressure in the streets. We will win this. I am absolutely sure of that.
Today has been fantastic as well. Definitely going to talk about future action, future strike action, and the constant need for ratios.
The fight continues. None of us like the situation that health is in at the moment, and especially our nursing colleagues, that we're struggling to deliver safe patient care.
After careful consideration and planning, I've decided that now is the appropriate time to conclude my role, and I can say wholeheartedly what an absolute honour and privilege that it's been to serve the association and its members for the past 32 years. Therefore, in accordance with the Association Rule 31, Shay and Michael are taken to be validly elected to the positions of General Secretary and Assistant General Secretary as of tomorrow 5 p.m. Congratulations, Shay and Michael.
The election of a federal Labor government with a coherent plan to fix aged care is a win for the ages and especially for our members in the sector.
And this is very much due to the extraordinary determination of ANMF members around the country through their daily work, their efforts for their patients, colleagues and communities, and their advocacy, lobbying and campaigning for improvements for all.
We can only win the battle if we continue to stay in the fight.
And we will continue until shift by shift nurse and midwife ratios are delivered in New South Wales.